For this, I would like to now invite someone who is extremely special to me, Captain Sanjay Shankar Pandey, Senior Vice President Nursing, Max Healthcare, President North Zone ANI, Ms. Willow Williams, Consulting Healthcare CIO Digital Transformation and NABH Digital Assessor, and Ms. K.S. Neetu, Lead Nursing Excellence and Digitalization, Bajaj Group, Member ANI.
Good afternoon, friends. Thank you very much for this response, even after such a great lunch, and I would say a stimulating presentation, quite enriching on numbers and new information. Economics, isn't it? Economics in healthcare. Now, this is something which elevates nurses. Nurses, when they start understanding and using data for talking. So far, nurses have been only talking कि HR के ऑफिस में इस मंथ सैलरी में 100 रुपया कम आया. क्यों आया कम? Isn't it? मैं तलवार निकाल सकती हूँ. Next month कैंप में 800 rupees कम क्यों दिया? And I feel proud of these nurses when they use this data to talk for themselves. It's great. Now, going forward, even this ANEICON had a great competition of reels, isn't it? And I'm sure the jury must have been challenged to have highest number of participants coming in. Now, look at it, this younger generation of nurses who are more intelligent than us, quite agile, very progressive and short-tempered too. But they know how to use data, but your nursing head of the hospital, if she is above 55 years, will be challenged to make a reel unless until she's a smart one, you know, who has paced with the times. Okay? She will actually struggle if she sees you that you know how to go live, not only on Facebook, but also to continue and have the longest thread in Snapchat. Ask your nursing head if she can do that. Got? Maybe, may not be. But yes, of course, every young nurse today, when I interact with them, 9 out of 10 nurses, they are ready to teach me. They know it so well. It's not that it's waste. No. It's actually, you know, they're pacing with times. They are absolutely abreast with times. Abreast with times. Is it happening in our patient space? Is it happening in our healthcare space? Because that same nurse comes and tells us in a study, I think Ms. Sunita Uppal, she's sitting there at the back, and she will agree with Ajita with me. When we concluded this study of mapping the works of our nurses for almost 1 week, be it in ER, ICU, ward, everywhere, 40%, it was ranging somewhere between 32 to 40% being spent only on documentation or various applications. Why? Is it my nurse doesn't know technology? They know it. Is she interested to do it? Maybe, may not be. It's boring. It's not engaging or interesting. But more importantly, if we ask her, how do you want it to happen? Even a staff nurse gave me 10 points. If this is like this, we will need less time. 59% of healthcare, when it's of nurses, they are the ones who actually define healthcare, and that's what we say. But are they really helping us in simplifying the healthcare? Because today's healthcare is not about having the star doctors in the hospital. It's actually getting defined with the quality of care, type of digital ecosystems the technologies, right, and the effective clinical outcomes in the hospital. Now with this, friends, this is the era of digitization, and the entire focus tomorrow for the healthcare evaluation is going to be the digital ecosystems in the hospitals. And that's the reason even India has embarked on the journey of digital healthcare standardization for the hospitals. So let's see now, because nurses, while they are heavily engaged towards their personal upliftment towards digital learnings and digital education, is it really working well on their inclusion in defining the something which is actually their bread and butter, the profession, isn't it? So how are we pitching ourselves in becoming a part of it? Are we really doing it well or not? Or are we getting missed out? Because nursing head gets every technology, every application to pilot in the hospital. She is the testing focus for the success of every digital modification, right? So joining me today, we have very expert two ladies. We have Miss Vilu and Miss Neetu, KS Neetu. Miss Vilu, not a nurse, but of course, an awesome, highly experienced, a subject matter expert in digital healthcare for since 34 years, having worked with eminent organizations of Jeslok, hospitals, Bajaj hospitals, the HN Reliance Foundation, but contributed in a significant manner towards digital ecosystem strengthening and designing for the hospitals in the country. KS Neetu, on the other hand, is a young nurse who had been one of the brightest younger generation millennials, worked extensively in the hospitals in all the roles of a staff nurse, quality nurse, infection control nurse, and further moved ahead towards nurses empowerment and currently working towards nursing quality and leading the EHR and digitalization in the Bajaj Group. So moving towards utilizing their precious time and the time which is reflecting on the dashboard here. Ms. Vilu, I actually ask you one thing. You have been designing healthcare applications, systems, softwares for multiple organizations. From where, in your experience, in the entire experience, the hospitals, they commonly fail when they miss out on the perspective of including the frontline nurses while they are deciding upon their healthcare frameworks, their applications, or their software choices?
Thank you very much, Captain Sangeeta. First of all, thank you, Annie, for inviting me here today. It's been a real pleasure to be here with you all. What I would like to say is it's not only about the frontline nurses not being involved, it's about everyone in the healthcare ecosystem has to be involved when we are designing applications, when we are implementing applications. Now there are two parts to this whole question. One is the designing and creating of the product. So a set of technical people, consultants, they do this, a software company does this, and they design the product. The second is implementing and adopting that product within the healthcare or the hospital ecosystem. Now this, see, most of the times vendors or companies don't really come and ask the healthcare people or the domain experts on what do you want, how do you want it, what is the main objective of your work where technology can make a difference. So I fortunately have worked on both sides. My first 16 years were in developing that kind of product, and the last 14 years have been as a CIO in healthcare. So to explain from that perspective, I will stick to that last 14 years today, because that is the core requirement where nurses come in for me. Believe me, it has been a huge cultural mindset change, even for me, when I moved from a consulting environment to a hospital environment. And when we discussed about implementing the systems in the hospital, when we choose the systems for the hospital, we make sure that every entity is involved in equal proportions in the decision making, because without that it would be a total failure. So to answer your question, where do I see things failing is either a CIO or a unit head or a hospital IT head is such a champion in the business side of the hospital that they don't ask anybody and they just do what they want, which is a short roadmap to failure. But when every entity of the hospital, be it nurses, be it doctors, be it the operations team, be it the finance team, the HR team, wherever we are implementing the area of the hospital or the software, we make sure that we have to involve them. So strictly now sticking to the nursing environment, it is crucial to involve the nursing in the EMR sections where they play a major role in how the clinical side of the data is going to be handled, how it is going to be used, how it is going to fulfill the entire, the functionality or the process or the workflow right from the patient's admission, even before that, from the OPD side, where vitals are captured, how the doctor is going to use those vitals in the case sheets, how the admission part is going to start or initiate the process to the discharge level. And at every stage, nurses have to come in because they are the users of the system.
I think
and if this is not covered correctly, nothing is going to, forget about me telling you one or two things failing, nothing is going to be successful.
So I think, Vilu, it's the most important thing here is that it's the amount of information, data, and the talent which lies in the hospital. Probably the CIOs, the unit leadership, the hospital, respective stakeholders need to be aware. But here I see that a certain degree of assertion is also required from the nurses to make them aware that this is the information, this is the capability which lies with nurses, which is continuing to be underutilized, isn't it? All right, moving from Ms. Vilu to Ms. Neetu. Neetu moved from hospitals to make a difference in the world of technology. And sounds too fancy, isn't it? Look, you're also smiling, I know. But tell me one thing, here it's not about what is the shift in mindset you experienced moving from a caregiver. You know, in the hospitals earlier, you were you were into patient assignments. Then you moved into an elevated role on monitoring and supervising the caregivers, isn't it? In nursing quality, hospital quality, and infection control. But now then you moved on to designing and leading technology with the industry partners. So what is the shift in your own mindset from moving from caregivers to a technology-driven domain?
Thank you, ma'am. Thank you for the question. Very good evening to everybody. So I want to thank Annie, first of all, for giving me this opportunity to give my experience related to technology, how it is helping me as a nurse to develop it for the nurses at the bedside. Rightly you said, ma'am. So being a caregiver, we have all our mindsets. We need to do patient care. We need to do the documentation. We need to take care of our supervisors. They will come and find out some errors or something, and nobody is there to help us. When it comes to developing an EHR from people who are not at the bedside, or I will not say wrongly that they are not at bedside, but of course they don't know the daily challenges. So where they will find that the paper which we are using as a document is converted into a EHR. So basically it is not going to help me as a nurse. So I find something, a thing that this is a challenge which somebody has to step in and tell them that this is what is required to help us, not to increase our work in documentation. So one thing is, one patient at a time, I want to impact on 1,000 patients so that like things can be covered. That was one thing. Where I find there is a gap between the multidisciplinary teams, where the delay of handovers or delay of informations, sometimes the doctors not prescribe the medicines can lead to a patient errors, or maybe patient is going further delay in their care. So here in EHR, when I thought of like system should be somewhere I am sitting as a doctor and I want to help my nurse who is there in the ward and handling the patient, must give a quick, I will say, a prescription so that a nurse will not fail into understanding what she is supposed to do with the patient. Of course, being a user, I know the challenges, and that made me to enable the system more efficiently for the people. That's my answer.
Ah, wow, that's interesting, Neetu. That's actually interesting to know your mindset, because probably there must be some tips now the nurses take on how to shift and how to take lead and how to be recognized as subject matter expert there. But moving on to my next question, point to Ms. Vilu is probably the pain point of majority of us sitting here who work clinically in the hospitals. If I ask my nurse today, are you happy feeding all the information in the EHR, EMR or CPRS, BCMA, the nursing app, the medical device app, the admission app, the discharge app, the checklist, the Google Forms, right? Or my training records, moving up in updating the data, be it for various other patient care points, so many interfaces, so many points. Ask them, they would say, no, एक case sheet दे दो, progress notes दे दो, एक nursing care plan दे दो, that is more than enough for me, I'll be grateful to you. Every nurse probably दिल में तो यही बोल रही होगी. Right? Because friends, it is about efficiency. Even I don't appreciate draining my time, precious time on this. So Ms. Vilu, when we talk of this efficiency and the precious work of nurses, you are the one who is actually designing this, and it may sound sarcastic, but it is the truth that you design and give it to them to follow, isn't it? And you talk of efficiency and effectivity. And then we ask the nurse leaders, your processes are not efficient. Any comments on this? How is it really true, or can we do something about it?
I can speak about this point for the next half an hour, 1 hour, but time is not, it's only 8 minutes left. So let me try to summarize this as quickly as possible. It's not about what system you are using. What you correctly said actually is that today the EMR is purely a documentation tool. Everybody talks about digitization with respect to documentation. Yes, it is important. The documentation side is very, very critical when you look at the newer technologies which hospitals are aiming to bring in from the perspective of data. When you collect data, when you collect digital data, and if that digital data is accurate, only then can you move ahead to better and more advanced technologies which will make your clinical life of the patients a lot more easier. Maybe we can go into AR, VR and AI and all that much, much later. But what you need to understand is this documentation that you do is the groundwork for building the accurate data for the future technologies. But that does not mean, and I know I've worked very, very closely with nursing for the past 4 hospitals in the 14 years. And I know really well what exactly are their challenges when it comes to documentation as well as when it comes to bedside care. Why? Because the documentation is completely on the computer. Their computer is not with them. They are at the bedside, and when they look for doing this documentation, how many of you really work with only mobile devices? How many of you are comfortable using mobility as you move around from patient bed to patient bed? That is one important technology change. If the screens of the system are not designed to create that kind of availability, it is another failure from the software side. Okay. Second thing is, there is a lot of technology where voice to text is enabled. How many EMR systems are truly accurate in building that voice to text, which makes the, the time and effort of a nurse at the bedside much lower. How many wearable devices as a technology have come out into the market? We all wear smartwatches. We all monitor various aspects of our health. But how much of that is brought into the hospital at a patient bedside to enable a nurse to have that ready-made information into the EMR? These are the areas that we need to look into, and which a nurse is absolutely right in demanding from a technology platform. Another thing is critical care. In the critical care area, you've got these bedside monitors which are having tons of vital information monitored in real time. How much of that information is correctly integrated into your EMR? We have done those things. What we need to do is make sure that you're not using only the central monitoring system, but you are actually enabling an integration where the bedside vitals are actually coming into your EMR. You are not expected to do the double data entry of that at any stage. We have got barcode technology, we have got QR code technology. These are aspects which can totally integrate all your data from your tubes, from your laboratories, from your blood bank, from your samples that you collect at the bedside. And once these things are generated from the system, you are not writing even, say, 30% of the data by hand or even at the computer. There are intelligence systems which can generate this by, the correct integration, by the correct interfacing, by the correct involvement of technology, which is still lacking in today's software. So what we ensure as a CIO in the hospital, we select those softwares with the help of nursing involvement to understand which software is truly enabling the nurse at their workstation, at their bedside, and for patient care.
I think still the responsibility lies with the nurses to be present at the right time at the design and stress upon the assert for inclusion, for making it more efficient, because unless until the stakeholders and the implementer is there, probably the entire concept will not add value towards the desired outcomes, isn't it?
So you are absolutely right in that. And just one point to add, what the product companies are doing today is when they develop and when they design and develop the product, they involve a lot of doctors. They actually hire doctors on contract to be involved in the designing stage. I do not really see the nurses' involvement at that point of care, because somehow it is always felt that clinicians are enough to decide what goes in. So I think the nurses can be brought into this aspect a lot more earlier.
Thank you. Thank you, Ms. Vilu. But moving towards, because we are very short on time, Neetu, any quick remarks from your side and any tips to the nurses who wants to shift from the nursing direct practice in the hospitals to the diversified roles, and especially like yours in the digital arena or any other, any other domain, but
Yes.
specific to digitization in healthcare.
Okay. So, answer to your question, ma'am. So, basically, I must say that nursing is the one who actually have the core area and know that patient and the requirement of other people in the team. So, I little disagree with Ms. Vilu, where she said that clinicians are getting involved for the development of the technology. There are the places where the nurses are also stepping in. And actually, I am very grateful to my organization. I've seen in abroad The nursing is the IT head implementer for a particular hospitals in abroad. So it is not only one hospital, it's a group of hospitals. So where I feel that energy. And of course, as ma'am, you asked me a few tips for the nurses who are coming up as a future. You guys full-fledged with the technology right now which you are having. We are millennials, we have seen the era of buttons. We have seen the era of touch. So basically now the technology is, it's like flourishing, and there are lot of I will say the processes are available and the certifications are available, trainings are available, but still you need a clinical experience. That is one main core for you to understand what exactly a nurse wants at the bedside, a patient wants at the bedside, maybe a doctor, a housekeeping therapist, anybody. So when we know that how the system works, it is easy for us to make a new system which is actually helpful not only for the nurses, for whole team. Because when we work at bedside, so not only the nurses, it's actually a multidisciplinary team. And when you are a nurse, actually you know better about your patient. And when the system supports you, as Ms. Vilu said rightly, there are systems where you don't need to type and put the information. You just verbalize it. Your voice to text information will help you to translate those information into the document. You just need to verify it and sign it off. So that's how the system works. So my few tips for everybody, there is no need of you to be a IT person to be a technology-driven nurse. You should be a very perfect nurse at the bedside to understand the challenges, to develop a system which actually help you to remove those challenges and flourish our profession frontline. Thank you.
I think that's brilliant. That's brilliant. And just parting message from Ms. Vilu. What is it which nurses can do to assert, and I'll request you to wrap it up in 30 seconds. What is it which nurses in every category, the nursing head or the clinical nurse, can do to assert and to be the influencer, to be included or to lead the digital designing in the hospitals?
Very quickly, I don't want to really upset any of the nurses, but we need time from the nurses. At every hospital, what I've seen is, I need nurses to actually get involved when they are called. Yes, I have seen a lot of mid-level nurses who were very, very interested when we were implementing systems, especially in HN Hospital, in Jaslok, in, whenever we came up with a new idea from a nurse, and we wanted to put that into practice, and we were looking for systems, searching for the right systems, we were actually happy to see that their ideas were workable ideas from a technology standpoint.
I really appreciate that. Thank you. Thank you very much. And before I wrap it up, only one message to my dear friends. We talk of empowerment. We say we are starved of inclusion, not being informed, right? I think picking the key word from the first session of today by Dr. Parag, we need to prepare ourselves to be good listeners. And here we come to know that take time out, but give time when someone is chasing because they want you to be included. So I think let the buck starts from us. We assert and we feel empowered. Wishes and regards to everybody because this is the era of digital healthcare ecosystem revolution. And we are the most critical stakeholders in building it for the healthcare community. Let's own it. Thank you. Thank you, Annie.
Thank you, Captain Sandhya ma'am. Requesting ma'am and the speakers to kindly move to the photo corner. Thank you.